Great question. First of all, thank you so much for having me here. And I heard healthcare come up multiple times in the conversation here. That is one of the biggest use cases for AI, in my opinion. And the theme of the session is promise and peril, and healthcare exemplifies that really well. The examples that you provided, you just talked about, are absolutely good use cases, the promise part of AI. I'll add something else. India has 1.4 billion people. A substantial proportion of those people don't have yet meaningful access to healthcare, although India is trying to change that through Ayushman Bharat and Ayushman Bharat Digital Mission. But there are 5 billion people in the world, 5 billion people out of 8 billion people who do not have good access to healthcare. In this day and age, that's inconceivable, and it's not something that we should be living with. And AI has the promise to flip the healthcare access on its head, turn it from tertiary care, highly qualified, hospitals like Stanford Hospital or Mayo Clinic or AIMS to local community-based healthcare delivery.
Give us an example, sir. I mean, a 35,000 feet view is appreciated, but if you come to eye level, how is life really going to get impacted for the person who is seeking medical intervention?
I'll give you a very specific example. During the second wave of COVID in India, lots of people were affected and a lot of people did die. And part of the problem was not that India did not have the ability to deal with the pandemic. It was a panic pandemic. People panicked. And huge reason behind that was that primary care healthcare system over the decades has been disemboweled. If you could use AI to empower ASHA workers and A&M auxiliary nurse midwives in the last mile so that they can actually not only diagnose the condition that is happening on the ground, but also take meaningful action right there so that 80 to 90% of the patients don't end up in the ICUs, in the large institutions. It changes the cost equation, it changes the health outcome, it creates jobs. So if we're talking about jobs, it actually creates new kinds of high-value jobs. These ASHA workers are going to become the new, I don't want to say doctors, but healthcare providers, which is high value for the society and high value for these workers.
Right.